We discuss epigastric pain due to spleen yin deficiency. When we study the pathology of the internal organs for the spleen, we generally emphasize spleen qi and spleen yang deficiency. This is understandable as these two patterns are indeed extremely common. By contrast, when it comes to the stomach, we do mention stomach yin deficiency. In fact, some people say that this is a well-known contradiction. The stomach is a yang organ, but it suffers from yin deficiency, while the spleen is a yin organ, but it suffers from yang deficiency. Although we nowadays emphasize spleen yang deficiency, some of the old classics did often mention spleen yin deficiency. For example, the Su Huan in chapter 3 says that the excessive use of bitter foods or herbs causes spleen qi not to be immersed. Modern doctors interpret spleen qi not immersed as spleen yin deficiency. Dr. Wang Lunti, Ming Dynasty, said that stomach fire may injure spleen yin. Qin Ji Chen says in Causes of Disease and Treatment, according to the pulse, the spleen may be deficient in yang or yin. In spleen yin deficiency, there is deficiency of spleen blood and empty heat arises. Tang Chonghai, author of Discussion on Blood Patterns, bemoaned the fact that since Li Tongyuan, author of Discussion on Stomach and Spleen, doctors paid attention to spleen yang but not spleen yin. The etiology of spleen yin deficiency is clearly dietary. It is caused by irregular eating, that is, eating in a hurry, eating standing up, eating while working at one's computer, eating late at night, eating while discussing business, eating while in a state of worry, etc. However, besides the dietary causes, spleen yin deficiency may also be caused by emotional stress related to worry and pensiveness, and by excessive physical work that depletes the spleen. The main clinical manifestations of spleen deficiency are poor appetite, distension after eating, dry stools, dry mouth and throat, dry lips, thin body, dull complexion without luster, night sweating, 5-palm heat only if there is empty heat, bleeding in small quantity, tongue without coating, red if there is empty heat, fine pulse. Please note that empty heat does derive from yin deficiency, but someone may have yin deficiency for years before empty heat develops. The tongue is in fact the best clinical sign to distinguish when yin deficiency has given rise to empty heat. If the tongue lacks a coating but it is not red, there is yin deficiency without empty heat. If the tongue lacks a coating and it is red, then there is yin deficiency and empty heat. The spleen controls yunhua, that is, transportation and transformation of food essences. Yunhua is impaired not only when spleen yang is deficient, but also when spleen yin is deficient, hence the lack of appetite. The yin deficiency causes loss of weight and therefore a thin body. Spleen yin includes blood and yin, and for this reason, spleen yin deficiency may cause bleeding, such as in the stools, vomit, or under the skin. Please note that the sign of dry lips, as this is quite a key sign of spleen yin deficiency. So this is the tongue picture of spleen yin deficiency without empty heat. There is no coating, but the color is normal. Spleen yin deficiency with empty heat. No coating, red colored tongue. Thank you for your attention.